So we're going to practice generating and controlling our intra-abdominal pressure so that we can stabilize our spine from inside out. First thing to do is to lie down on your back with your knees bent. With the knees bent like this, we can comfortably almost flatten out our lower back. And what you want to do is to sigh out to let the ribs settle down. As you do that, you might be able to feel that your upper part of the lower back, around L3 or 4 area, gently pushes the ground. So almost flattening your lower back. Good. And then hands around the muscles right above your pelvic ridge. And this finger goes around the muscle that's a little bit inside of the front hip bone. From there, I want you to cough a little bit. And you'll be able to feel that you're able to pressurize and increase the tension around the area where you're grabbing with your hands. And now, hold the breath and then try to recreate that pressure and tension around this area. What you're doing right now is to use the diaphragm as a stability muscle. Once you do that, then we're going to try to breathe into the tensioned and pressurized area. Now we're using the diaphragm as a respiratory muscle. And as you breathe out, try to maintain the tension and pressure around this area. The volume itself will eventually decrease a little bit because of the exhalation, but you should be able to keep the tension and pressure here as long as you can. Now that's the basic. And we're going to maintain that breathing technique and this tension all the way through this exercise. Step 1. You're going to lift one leg up. Check the pressure. And leave this leg up here. And then bring another leg up. Again. Keep the pressure, tension. Slowly breathe in and out. Then bring your arms up. Let the shoulder blades heavily falls on the ground. Take about 3 breaths. And if you feel that your lower abdomen deep inside working without feeling too tired here, you're ready to go to the next stage. Next stage is letting your arm fall down to the side as you follow your gaze towards this fingertip here. Making sure that you're still keeping the pressure and tension. Don't let the pelvis rotate. And shoulder blade still heavily attached on the ground. Now do that about 3 times. And if you're still okay, that you can feel the target area without feeling too tired here, we can go to the next stage, which is dropping the leg without losing the pressure. Slowly. And remember that L3, 4 area that has a little bit of tension, little bit of pressure towards the ground. We want to keep that as well. As we do so, we will feel that as we breathe in, we are able to expand sideways. That's it. Great job.